So please note that this meeting is being recorded, and if you don't consent to being recorded, you are asked to kindly drop off the meeting at this time. And thank you for your understanding and cooperation. And also that this recording will be made available on our NIHB's YouTube channel. Okay, so, and you can go on the next slide, please, Don. So welcome everyone. And again, thank you for joining us today for our Maternal Health Promotion Institute with a particular focus on American Indian and Alaska Native mothers and communities. My name is Alicia Snetti. I am an enrolled member of the Navajo Nation in New Mexico. I serve as a public health policy and programs project coordinator here at the National Indian Health Board. And it's really a true honor to be in this space with all of you, along with my three colleagues today, Dr. Lori Garg, our Maternal Child Health Programs Director, and Brene Berner, our Project Specialist, and Don Landon, who is NIHB's Tribal Oral Health Associate from the Oto, Missouri, Kiowa, and Iowa tribes. So before moving into the program, I would like to set some intentions for today and ground ourselves with a prayer and blessing from our own Brene Berner, and who is an enrolled member, tribal member of the Native village of Kiana in Alaska. She is a current PhD student at Johns Hopkins University in environmental epidemiology. She works on special projects here at the National Indian Health Board. She has over 28 years of experience working in tribal health, and her passion in addressing health disparities in tribal and indigenous populations through health research, policy development, education, and outreach. She is a firm believer in community-based approaches to best tap the existing strengths and resources our resilient populations already possess in order to garner additional resources and greater understanding of the overall health needs and priorities of our peoples. And that she'll also like to note, culturally intelligent approaches are needed to build upon evidence-based approaches. So with that, I'll hand it over to Renee. Thank you.
Arigateku. Uvanga atiga kanak, yami guranga, anaga bakak, anagora kanak. It is good. My Inupiaq name is Kanak. My legal name is Brene Berner. I am from Kiana, Alaska. My mother is Bakak. My grandmother was Kanak. I open with a statement from the National Indian Health Board CEO, Stacy Boland, who shared that our women, our mothers, are the sacred vessels of life. We hope to honor them and raise them up today and tomorrow. I'm honored to provide this welcome and prayer. As I share this welcome, I will share with you, my family, my tribe, and our Inupiaq Ilocosate, our values, which are not unique to us, but are often shared among many of the tribes and indigenous peoples across the world. Those values include love of children, family roles, humor, and responsibility to tribe. As we begin the seminar to raise awareness and champion maternal health and fight maternal mortality and morbidity, we hope to honor and reflect on those we have lost, recognize those who have overcome, and those who thrive and carry us forward. My history, as I know it, starts with my great-grandmother, who was born in the traditional way. Her mother went off into the tundra and gave birth to her alone. My grandmother was the eldest daughter and served as a second mother to her siblings until becoming a mother herself, where her youngest sister served as a second mother to her 16 children and no twins, losing 5 as infants and toddlers to infection. She was one of the first generation community health aides in Alaska and helped countless mothers over 27 years serving in this role, even helping mothers give birth while in the air in a bush plane on their way to Kotzebue, for there are, to this day, no roads connecting our villages. My mother was born on her mother's birthday. She gave birth to her firstborn 2 months early via emergency C-section. He was just 4 pounds and required a blood transfusion. Both were in the ICU, separated and fighting for their lives for 3 days. She gave birth to me 2 years later, a month premature, breaking their plans to deliver me via C-section, as was the practice when a mother already gave birth via the procedure. My late sister followed in my grandmother's footsteps and gave birth to her youngest on her own birthday. I faced my own challenges in my birthing experiences as I experienced regular contractions at the start of the 3rd trimester for my youngest. I had to medically halt the contractions. At the time of his birth, he was not setting into the opening and was posterior facing. We were at risk for needing an emergency C-section ourselves. In reflecting on my maternal family's experiences and my own, I am proud to say we have come far and there is much to share. We thank you for joining us today. And with this, I ask you each to pray in your own way. Creator and ancestors, we give thanks for those who have come before us, who have passed their wisdom from generation to generation for millennia, who have carried tradition and honored our cultures, but have not remained static, who have insisted on the best care for our peoples, and recognize our actions will impact the 7th generation, putting our grandchildren's grandchildren in our hearts and in our minds. We remember those mothers and children we have lost and who have joined our ancestors. I am thankful for our leaders, our presenters, our staff, and the planners who have joined us here today, championing our children, our mothers, and our people, respecting our tribes, loving our children, and honoring our family roles. Ariga deku lepak.
Yes, thank you so much, Brene, for leading the opening blessing for our institute today and setting our attentions as we move forward today and tomorrow. As we know, we'll have discussions about maternal morbidities and mortality. We recognize the importance of addressing these critical issues with sensitivity and compassion. And we also want to emphasize to all of you as we move forward, we encourage you to give yourself breaks as needed, because we understand maternal mortality prevention is a sensitive topic, and that we do have one scheduled break later today, but just want to encourage throughout the day, please take the time you need for your well-being and know that we're all here to support. So, and you can move to the next slide, please, Don. And today we gathered here with a commitment to addressing maternal health issues specific to American Indian and Alaska Native communities. And throughout this institute, we'll be hearing from a variety of maternal health leaders and organizations that aim to improve the health and well-being of Native pregnant people, mothers, and families, while also being grounded in cultural practices, beliefs, and values. So we wanted to, here's a rundown of our agenda. You'll see we have 4 presentations today, and we also included that 10-minute break to recharge from 2:45 to about 2:55 Eastern time. And I'll be sharing the link to access our agenda in the chat shortly. But as you see, we have allocated time for after each presentation, about 10 to 15 minutes for questions and discussion. So during those times, I encourage you to ask some questions, whether in the chat or unmute yourselves using the raising hand, function. And that together, together we'll be drawing on expertise from Native community leaders and community-based organizations that have those hands-on experience in promoting maternal health. And I also want to emphasize our institute was created and our focus is not solely on highlighting deficits, but on sharing knowledge, best practices, and culturally grounded approaches that can foster meaningful and sustainable improvements in maternal health outcomes. And also want to acknowledge that this institute was made possible through a collaborative effort with our CDC project team under the Division of Reproductive Health. And I'm very grateful for their partnership in driving forward this essential work. I also want to thank all of you, our speakers, and everyone who made this virtual institute possible, and that your dedication to this cause and your presence here today is very crucial when it comes to our collective effort.